Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast. I've been thinking a lot about pregnant women, specifically Black females. Picture this. You're a Black female, you're excited to be pregnant. You decide that you want a Black OB, female OB, because you know that Black women in general are at an increased risk of having bad outcomes. You don't know exactly why, but you know that there's an increased risk. You know that you don't like hospitals. You don't want a cesarean section. You consider yourself to be healthy, and all you really want is to have a healthy baby. So now you're thinking maybe I will get a midwife. And better yet, maybe I'll just have a home delivery, a home delivery with a midwife. And that sounds very appealing. Um, and that's in spite of the fact that we know that every year we see the national vital statistics regarding maternal mortality rates, and each year the report shows that Black women die at a significantly higher rate. And we shake our heads. We look at the maternal mortality review boards for clarification. We talk about systemic racism, but nothing seems to really change. There's no improvement. There's no decline in the mortality rate. So, what does a Black woman do in this type of scenario? Because she knows that irrespective of her education, her address, her income, she's at a higher risk for a bad outcome. And so Black women have been actively seeking out ways to decrease these odds. And one way has been to try to seek out Black OBGYNs, specifically Black female OBGYNs, but that can be a hard task, hard to find. Other Black women have sought out doula care, and that has been helpful for many. And then there are those who, from the start, know that they don't necessarily want a Black female OB. They want a midwife. And it seems as though there's been an increasing desire in this country for home delivery. Now, to put it in perspective, the number of home deliveries in this country are still very small. about 1% of all the deliveries. But there's been an upward trend in the number of women that are considering and seeking home deliveries. And for a Black woman, there's the possibility that she would not encounter inherent racism that's prevalent within hospitals. And while we know that right now, white women have they tend to opt more for home deliveries, the number of Black women considering and then choosing a home delivery has been increasing, particularly since COVID or possibly as a result of COVID. And so I just like to talk briefly about things you should consider if you have thought of a home delivery. Home deliveries, no question about this. Home deliveries should be reserved for low risk pregnancies. Um, the mom shouldn't have any major medical condition. The mom should not have had a previous cesarean section. And her pregnancy, throughout her pregnancy, the pregnancy itself should be without any obstetrical complications, such as gestational diabetes, preeclampsia, you name it. And so, if a Black woman or a woman in general were to consider a home delivery, there needs to be a careful assessment. Number one question being, are you low risk? And how does this fully get assessed? This has to be assessed by your provider, whether that's a doctor or midwife. There has to be an assessment of, first of all, are you a low risk patient? Are you a candidate for a home delivery? And if the answer to that is yes, then there are more questions to be considered. Before saying yes to considering a home delivery, you need to consider all of the possibilities that could come, such as you need to have a conversation prior to about what happens to my care if I should develop a complication during the pregnancy. Will you take care of me, or where will you refer me to if a complication develops during the pregnancy? And then, really, what happens? So, where do you refer me if I develop a problem during labor? And if I need to be transferred to a hospital, what hospital would it be? How close is that hospital to where I would be? And how would I get there? What type of transportation is arranged? All of these questions are really important questions that shouldn't be asked at the time of an emergency. They should already be known and clear to everyone involved. Other questions you might consider asking your midwife. Are you certified? Not all midwives are certified. Do you carry malpractice insurance? Not all midwives carry malpractice insurance. How long have you been delivering babies? Who is your backup if there's a complication? Oh, yeah, these are awkward questions. And in fact, these are good questions that you probably should also be asking your OB, because we're talking about you, your life, your baby's life. And so these are all really, really good questions, worth considering. Definitely a conversation to be had before saying yes to a home delivery. And let me be clear, in a low risk situation, a home delivery can actually be a beautiful experience. In fact, in a home delivery, or preferably in a birthing center, which gives you the luxuries of being at home without the instrumentation and the technology typically associated with a hospital. Um, in these low risk settings, a low risk pregnancy, um, a delivery of a low risk pregnancy in these low risk settings may actually be the optimal way to give birth. Um, understanding, all the way understanding that emergencies can and do sometimes happen. And when they do, minutes matter. So, enough of that. Whether you choose a hospital or home delivery, whether you choose an obstetrician or a midwife, choose wisely and let us all work for better maternal outcomes. And until the next time, this is Dr. Rahman saying, be well. If you found this valuable, share it with one friend and join my email community at drrahman.com. That's where I keep it real. No censorship, no noise.